Hello, everyone. Hello to those of you that are joining us for the first time today. Welcome to our Facebook Live. I am here. I'm Laura Fernandez-Diaz. I work for Members and Partners Development at UICC. And I'm here in Geneva at in our kitchen, actually. And I'm in a great company here of Janine, who recently joined UICC and is the new face and force behind the World Cancer Day campaign. So welcome, Janine.
Thank you, Laura, for this really nice introduction. And hello, everyone. And I hope you're well from wherever you're joining in the world today. And welcome to the launch of World Cancer Day. And I am just really thrilled to be part of this global community and of this, this amazing legacy that I'm inheriting. I know that you have achieved some pretty impressive things last year.
Yes, I can only agree to that. It's been amazing, and it's amazing what we can achieve when we do it together, and we're counting on our members and our supporters, and in every single way. And I actually have some amazing figures to share, and I will share them with Janine and with everyone because they're pretty impressive. For example, we register 840 activities in 113 countries on World Cancer Day 2021. We were trending on Twitter for the last 2 years, actually. We counted almost 700,000 social media posts, and we illuminated, and here comes the drum roll, 152 landmarks in orange all over the world. Like the list just goes on.
It's really, really incredibly impressive. And it gives a lot of hope, which is what World Cancer Day is all about. It's about bringing hope. It's about raising awareness. It's about it's a date where we can express our solidarity with those who have or are touched by cancer in one way or another. Mm-hmm. And it's just really a day where we get together and celebrate this importance.
Yes, absolutely. But I think, Janine, what we are all waiting for is to hear what's been going on with World Cancer Day. What's the new campaign looking like, and the tagline.
Yeah, this is a really exciting moment for UICC, and I'm really happy to share that we will be talking about the urgent need to close the care gap, which is also the tagline, Close the Care Gap.
Ooh. Amazing, Janine. And why are we talking about this?
Well, the reality for many of us is that where you live and who you are could really mean the difference between life and death. And while there has been amazing progress in medicines, especially in cancer care and control in the last 20, 30 years or so, a lot of people are still missing out. And that is just really not fair. It's not right. And we can change this. So we should change it.
Mm-hmm. You're right, and it is about equity, and it really is a concept that resonates a lot with our community. And I'm actually thinking that I know a person that will be so great to explain kind of this new direction that the UICC and World Cancer Day is taking, and that is our CEO, Dr. Kerry Adams, and I believe that he has recorded a message that he will be sharing with us. So over to you, Kerry.
My name is Kerry Adams, and I'm the CEO of the Union for International Cancer Control, based here in Geneva, Switzerland. We're the team behind World Cancer Day every year. And as we approach February the 4th, we have a new theme and a new campaign for 3 years, Close the Care Gap. We have seen over the last 20 months the challenges that people have had to get treatment and care, with screenings being cancelled and people being hesitant about going into a treatment centre to have their treatment for their cancer. And cancer organisations have responded brilliantly by supporting those patients through their journey, despite all of the difficulties that they have faced. It's also created a lot of innovation, and we've seen organisations reach out to patients in new ways online to support them. We've seen advances in diagnostics and remote delivery of the treatment and the care. So there has been some silver linings. However, what it has revealed is the deep inequities which exist in society, which stop many getting the treatment that they need and they deserve. So there's lots to be done. So join us on World Cancer Day and raise the issue of equity around the world. Let's close the care gap, and let's start on World Cancer Day. Every action that you take will make a difference, and make sure you let us know beforehand what your plans are for February the 4th. Go to the website, worldcancerday.org, look at the toolkits, download the posters, tell us what you're doing, and put your event on the map of events. We want to know what you'll be doing. And if you're doing something on social media, remember to use the hashtags World Cancer Day and hashtag Close the Care Gap. I look forward to hearing everything you'll be doing for World Cancer Day. It'll be a tremendous year. Let's remember, let's address inequities around the world. Thank you.
Thank you, Kerry. Thank you for your words. And this is really exciting direction that World Cancer Day and UICC is taking. It makes a lot of sense, actually, because equity, it really is the red thread on all the work that we're doing. Just like a couple of weeks ago, we dedicated our whole World Cancer Leader Summit to this exact same topic of equity. And it really does resonate with our community, as we were saying. But maybe we can now hear a little bit from you, Janine, how is going to be the rollout of the campaign over the next 3 years?
Yeah, absolutely. So only when you know about a problem, when you understand it, can you really care about it and then do something about it. So this is what 2022 is all about. It's about recognizing the inequities in cancer care around the globe. It's about understanding them, how they are in different contexts. And then it's also about having an open mind, challenging our own assumptions, because we all have them. And it's about looking at the hard facts.
Mm-hmm. Yes, indeed, because we know that inequity in cancer care costs lives. Like it's as simple as that. That people who seek cancer care, they hit barriers at every step. And those barriers, they can be income, location, discrimination based on ethnicity, gender, age, so many different factors. And these are just basically some of the factors that can negatively affect care, because basically the gap affects everyone.
Yeah, exactly. And that is exactly why we want to hear from you, from our global community, from our supporters, and from our members, what inequities in cancer care you are facing, what it looks like in your context. So this is what we want to do in 2022.
And what about 2023, 2024? What's coming?
So 2023 is about uniting our voices and taking action. So we will join with like-minded people, because we are in this together and we know that we are stronger together. And we will celebrate real world progress, because there is progress, in whatever shape and form this comes. And we will use this to fuel our fight for fairness. And we will mobilize our friends, our family, our coworkers, anyone that is in your network, in your circle, to really rally behind this important cause. And then 2024, the final year of the campaign, it's really about taking it to the next level. So here we want to challenge those who are in power. We want them to address the root causes of these inequities. Because once we have the knowledge and once we have a community by our side, we can take this to the next level and we can change this.
Absolutely. And it's such a powerful message, Janine. It really is excellent. I'm sure that our members from all regions, they will be so keen to get involved.
Yeah, I really hope so. That's really my biggest hope for this campaign. And actually, I think this would be a great moment to ask one of our members, what cancer inequities, what it looks like in their context, so if it resonates with them.
Absolutely.
Who could we call?
Who can we call? I'm thinking about considering the time. I think it's good to connect with Central America. I'm thinking Basic Health International, our dear friend Karla Alfaro, that she is, she's in El Salvador. So it's really a good opportunity to connect with her.
All right, let's call her.
Perfect.
Oh, hi, Karla. Can you hear us?
Hello, hi.
Hola, Karla, bienvenida.
Hola, thank you. Thank you so much for this invitation, for the launch of this very important campaign.
It's great to have you.
Oh, absolutely. Yeah. So, Karla, perhaps you can start by sharing with our viewers how Close the Care Gap resonates with you personally.
Well, for me, on a personal level, this campaign theme, Close the Care Gap, gives me hope. So inequities in access to health are a reality. Not everybody has access or the same opportunity to have the best healthcare available. And it's simply not right. So creating that awareness is very important, not just for the general population, but also for different organizations and governments. This can lead to take action and improve access to health and closing that gap.
Thank you very much. That's excellent. Yeah. And what is the topic of inequity an important topic for Central America and for El Salvador specifically?
Yes, it is a very, very important topic for the region, and even more. So with the COVID pandemic, the health services have been deeply impacted, And countries need also to address the fact that there is a delay in all programs, right? So delays on treatment, clinics are still not working regularly, healthcare personnel is overburdened because there is not enough personnel. The same personnel that runs of different programs are involved in taking care of COVID patients, COVID vaccination. So it will definitely be a challenge, and it has to be a priority for every country. I think equity in health and cancer depends on different aspects, coordinating efforts between governments, civil society, researchers, industry also, to make available tools available to reduce these inequities and to make services available for everybody.
Absolutely. I mean, you are sharing there a lot of excellent insights, Carla. Perhaps it would be really nice to share from Basic Health International, what are you planning to do with the campaign, and how can you maybe motivate other organizations that may not know yet what are they doing?
Well, Basic Health International is an organization that is committed to cervical cancer elimination. And our work focuses on research and to validate new affordable technologies for screening, for treatment, and also implementing these technologies in different countries. So with the call to action for cervical cancer elimination, there is a need to make these technologies available. So we will continue to do the research. We will continue to advocate to different governments to make these technologies available. And also with the campaign specifically, we will be actively involved in sharing important information, education through our social media outlets, and also something that we have done in the past and hopefully we will do next year for World Cancer Day is a symposium. Every year we host a symposium, and this will be around the theme of the campaign, Close the Care Gap. So where government and Ministry of Health authorities will be involved, so we can, advocate with the decision makers to continue to make technologies and treatments available for everybody.
This is really excellent. I cannot wait to watch the symposium and follow all your activities next year. I think that we have kind of run out of time with our interview with you, Carla. So it was really great having you part on this Facebook Live. And so thank you so much for calling in today. And I hope you have a wonderful day.
Gracias, Carla.
Thank you. Gracias.
Bye.
Bye. Bye.
This is always great to hear from our member organizations and the work that they do and how they engage with the campaign is really it's always incredible. And I want to send again a big thank you for their participation, and especially to the members of the advisory group for World Cancer Day that they help us so much along the way.
Absolutely. I think also this would be a great moment to talk about the specific materials that are available, the activities that we have planned for World Cancer Day, so that you can get inspired for your planning for next year.
Absolutely, let's do that.
Great.
Yes.
So the first thing is first, all information related to World Cancer Day is found on its hub, which is the website worldcancerday.org. And this is where you can find all information related to the campaign, cancer in general, campaign material, activities, and ideas on how to get involved.
And that sounds excellent. How can we look into more detail? Perhaps how can they get involved, like our supporters?
For sure. So some of the activities, for example, I could mention we have a new 21-day challenge, which is focused exclusively on inequity. And if you want to learn about cancer inequities in an easy and super digestible way, you can subscribe to the 21-day for Impact Challenge, Close the Care Gap. You can also test your knowledge by completing the equity quiz. Both of these activities can be found under the Take Action tab of the website.
That's sounds like such a fun way of actually learning about such a complex issue. So it's really interesting already just by looking at it. What else can we do?
Well, of course, we can do lots of things. So, the main focus for next World Cancer Day is learning about the cancer inequities. So this means that we want to hear and we need to hear and to listen to perspectives from different people from all regions. So please share your stories and let us know what cancer inequities you are facing. or which ones resonate the most with you. And you can do this by going on the website and click Take Action and then share your story, and then fill in the form to be featured on the World Cancer Day website.
Oh, that's excellent. I can't wait to see and read all these stories from all these people. This is excellent, Jenny. Like really, what other materials perhaps are available for members and supporters?
Yeah, so we have plenty of content ready to use for our supporters, for our members. To find these, you just have to click on materials, and there is the library. You will find the how-to guides, the World Cancer Day, and close the Care Gap logo files, so you can make your own cups like we did this afternoon. And you can find social media banners, infographics, action toolkits, and campaign posters, so you can really make this campaign your own campaign.
Oh my God, the posters are always so much fun to do and see. And I see that all of this is available in English. Is this going to be available in any other languages?
For now, they are available in English and some other languages, but we do aim to have all material translated and available by the end of this month. The additional languages we're working on are Spanish, Brazilian Portuguese, French, Russian, Arabic, Chinese, and German. And if you would like to help us with the translation, I would really welcome that. The translation into the other languages that we didn't just mention now. And you can send us a message at hello@worldcancerday.org.
Yes, that I think is an area that we really, our supporters and our members, they really appreciate the multilingual. Like I can't even say the word anymore. But in any case, multilingual. Thank you.
You're welcome.
Aspect of the World Cancer Day. So really, really looking forward to it. And I'm just thinking about a particular event that took place last year. What about the Solidarity Challenge?
Right. I'm really excited to announce that there's going to be a second edition of the World Cancer Day Solidarity Challenge with our partner Orson. And for those of you who do not know what the World Cancer Day Solidarity Challenge is, it is a virtual global race on Swift, the platform Swift, bringing together over 60,000 cyclists and some of the top names in the entertainment and sport industry. And they come together to raise awareness and funds for World Cancer Day. And some of the celebrities that are already confirmed are Sir Mo Farah, D'Angelo Williams, and Paula Radcliffe. So if you're interested, please make sure to stay tuned for the global broadcast on 4th of February.
Oh, that's an excellent one. And actually last year it was incredible with Mo Farah and all these incredible celebrities. So definitely want to watch. But now I think maybe it's a good time to see who is connecting with us live.
Yeah, if there's any questions. Maybe,
we haven't mentioned this before, but questions and comments are very much welcome, please. So don't hesitate.
Send them in.
If we don't address them right now, I think as you were saying, we will follow up. And there is the different address. I can see already some familiar faces there, or names at least. We have the Children Cancer Center of Lebanon joining us live. So hello. I just want to send a big hello to them. They are always so engaging with the campaign. And Janine, I mean, this is your first year, so you will get to see and know all of the incredible stories that come behind World Cancer Day. I see Kansa, where we know Kansa. We have our dear colleague from the advisory group, Lucy, so we can send her hello as well. And thank you for joining us as always in World Cancer Day.
And from Mexico.
Buenos dias, Mexico. We have Buenos dias, Latam. I think it's good to reflect on that and to remind them that materials on the website that you may not find now in Spanish will be translated to Spanish before the end of this month. Are we going to?
Hopefully, fingers crossed. Yes, that's the plan. That's the plan.
But that is definitely a community that gets extremely involved. And I think last year it was incredible, all the activities that happened in Latam. And this year, I am challenging you to do just as good or even better.
I can't wait.
With the Close the Care Gap, I guess we will see when the materials get translated, what would be the translation of the. So we are not going to give that information away yet. Not just yet. Oh, from Brazil, we have Instituto Amor. Boas tardes, or bons dias, no?
I don't know any Brazilian Portuguese. I apologize.
Namaste from India. We have from El Salvador. Well, obviously, we just had Carla joining us. Morocco. I mean, this is going really, worldwide. As we were hoping.
This is great.
So it's really. I mean, I just have a question myself that it just pops in my head. because I know that the community gets very engaged behind the hashtags, the official hashtags. So can you tell us a little bit about what are going to be the hashtags?
Yeah, for sure. I mean, we're still going to use World Cancer Day hashtag, the hashtag World Cancer Day, and then the other hashtag, which is for the campaign, which is Close the Care Gap. So these are the two hashtags that we will be using. So I look forward to seeing you tagging us on your social media posts, and yeah. So yeah,
wonderful. I think it's really, this is all been so helpful, and I invite everyone to share this Facebook Live once will be obviously posted on Facebook and the different social media to go back and look at it, because there's so much information here that I think is so helpful. But I think I believe that's pretty much all the time we had.
Yeah, well, I would like to thank you for joining us, and also I would like to give a specific thank you to our current and past sponsors and partners. And we hope that our members and everyone really will make this campaign your own campaign. Please use it. But I wouldn't leave without leaving a little bit of a surprise for you.
Oh, a surprise!
Yeah. So I would like to share our World Cancer Day video with you. It's shown today for the first time to the public, so I'm really excited.
Well, in that case, I think it's extremely exciting. So I'm not gonna take more time to say my goodbyes, and I just say until next time, hasta pronto.
All right, and before you go, watch the video right here and right now.
Young and old, rich and poor, black, white, and every color, male, female, trans, and other, the right and the left, east and west, followers, leaders, believers, and none, everyone. Far more unites us than divides us. So let's all agree, the people and the powers that be, to make the world aware we need to close the gap in cancer care.